ASH 2015 coverage continues. I'm Thomas Baldrick. We're happy to have back with us Dr. Lynn Wang from the University of Chicago Medical Center. Thank you, my dear, for stopping by. How are you?
Good, and I'm so glad to be back and continue talking about our recent publication.
Yeah, let's talk about that. You just published a paper in Oncotarget evaluating Cerdulatinib in diffuse large B-cell lymphoma. What's the rationale behind this?
So far, diffuse large B-cell lymphoma is one of the curable lymphoma. However, there's 40% patients are not curable. Right now they keep having relapse, and so there's many new drugs are being developed for these relapse refractory patients. There's a class of drug they directed against B-cell receptor signaling. And so, however, the clinical efficacy of these drugs are a little bit disappointing. So there's a SYK inhibitor, there's a BTK inhibitor, there's also a PKC inhibitor. But these inhibitors only generate fewer than 20% efficacy in these group of patients. So basically, when we started collaborating with Portola pharmaceutical company, they have this dual inhibitor. So in addition to inhibit the B-cell receptor signaling pathway, the compound also inhibit the JAK-STAT pathway. So we think, and then as a pathologist at the University of Chicago, we did an immunostain and to look for how many tumors express SYK, which is a BCR protein, and also JAK and also STAT3. And so by doing that, and we found about 60% tumor express either SYK or STAT3 or in combination. So we thought so instead of having a drug targeting 20% of a tumor, and this drug may have efficacy in at least 60% of tumor. So that's why we started evaluating these at the bench and doing studies in the test tubes.
Did you find that there are unique qualities to this agent?
Yes, absolutely. And our lab has been working on B-cell receptor targeted therapy. So we have a really direct comparison of this dual compound versus a single BCR targeted therapy. So there are two things we see with this compound that were not seen with other compound. So the first one of all, this compound has much broader activity. There are two subclasses of diffuse large B-cell lymphoma. They're called ABC and GCB. So this drug has activity in both classes. So in 11 cell lines we tested, this drug is effective in every single cell line. So that really makes us truly believe this drug should move forward for clinical development. So second of all, other drugs we have tested, like a dasatinib and pure specific SYK inhibitor, they only inhibit cell cycle. This, in addition to inhibit cell cycle, it also induces apoptosis, make cell die. So those are additional cellular activity of this drug are not seen with other drugs. So that's the two new things we have found with this drug.
So where do you go from here?
So right now, Portola, this is a compound, and Portola is conducting clinical development. So right now it's undergoing phase 1 clinical trial. And then there were a number of abstracts at this ASH that will be presented on Monday evening, showing the phase 1 clinical trial results, and so looking at the toxicity versus efficacy. So I do encourage people to come to get more information. We're very excited. This drug is moving into clinical trial.
I can sense your excitement with this. It's genuine.
Yeah.
Good for you.
Yeah.
Congratulations. Thanks for coming by. Appreciate your work.
Yeah. Thank you for having me.
You got it.
Yeah.